And joining me right now is Dr. P. Raghuram, President, Association of Surgeons of India. Dr. Raghuram, I want to know from you, these ever-increasing numbers, right? Now we are adding 15,000 patients per day. Every day we report that, this is the first time such a dramatic increase has happened. Where does this leave our medical apparatus? Are we in tune with the number of cases? Can we handle these cases?
Good evening. The answer is no, and I think we are trying to cope with this rapid surge in the number of cases. For example, in Telangana, where I come from, there has been a rapid surge in the number of cases because the testing has increased, and just in the last 1 week, we have seen about 3,500 new cases being diagnosed, and this accounts for 40% of the total so far. So I think with the increase in the testing and also with the lifting of the lockdown, where people are now freely moving around, the number of cases being diagnosed are increasing, and it was expected. And I think the lockdown has allowed us to, in many ways, strengthen the healthcare system. But we must also understand that our healthcare system is very fragile, and for us to cope with such a big surge is becoming difficult, even in big cities like Hyderabad and many other places.
Now, Dr. Raghuram, one comment, because this is a brand new, fresh controversy that has erupted. I wanted to know from you, what is the procedure of declaring something as, a medicine to fight COVID-19? Because you've got a claim that is being made by Baba Ramdev, Swami Ramdev, who says that he's got this wonder drug called Coronil, and he has carried out the trials, and it's fairly successful. In fact, he was about to go and plan an advertising campaign also. And then the Ayush Ministry comes and says, wait, hang on. First, quickly tell us what all procedures have you followed? But the question that I want to ask you, Dr. Raghuram, is that in the process of the government saying, did you follow the procedure, and Baba Ramdev having declared that I've got the medicine, do you think there will be a lot of raised expectations among the people which should be avoided at a time like this?
Absolutely. I think before anything is declared as something which is effective, there must be evidence-based and a robust evidence base. And this has happened with HCQ as well some time ago. And without having robust evidence, just because a politician or a celebrity says that this is the best treatment or this is a new treatment which is being introduced, I think the people have to be very cautious, and the media also have to be very responsible in reporting this, because it creates a level of false assurance that people taking this, will be cured of the virus. So I think we should be very careful, and the government must closely monitor any announcements that are made, and these announcements must not be allowed to be made unless it has the necessary clearances.
Okay. Dr. Raghuram, do stay on with us. Dr. Ravinder Mehta is the Chief of Critical Care Pulmonologist at the Apollo Hospital, and also Dr. Vivek Nangia, Principal Director and Head Respiratory Critical Care Medicine at Max Saket. Thank you, all of you all, for joining us. First of all, Dr. Mehta, I want to begin by asking you, because we're talking about this wonder drug. So maybe your opinion, do you think that these claims, before these claims are made very openly, it should be made with a great sense of responsibility, whether they have been able to clear the mandatory checks and balances before making the announcement? I'm talking about this trend all day today called Coronil, a medicine which has been declared as the solution for COVID-19 by Yoga Guru Baba Ramdev.
Yeah, so if I am to be considerate, I will use Dr. Raghuram's stance where, you cannot put things until they've gone through the filter of evidence-based medicine.
Target the virus. Sorry. I think these are very irresponsible comments to come from celebrities and important people, and it has certainly caught the media attention, and all through the day, all the television channels have been focusing on this. I'm sure a lot of damage has been done, and as you rightly said, since this all belongs to the class of Ayurvedic drugs, then the Ayush Ministry should really come forward and issue a strong statement to that effect so that this can be stopped where it has started. Otherwise, it's going to do even more damage in the coming days.